For Vanita Coleman, healthcare isn't a political debate. She's lost her coverage for herself, her husband, their 5-year-old son, and their month-old daughter. She's struggling to balance housing costs, groceries, diapers, and everyday bills. And she says every month feels harder than the last.
It's very, very expensive. Diapers definitely done raised up. Clothes definitely done raised up a lot. Food, formula is high.
Vanita once had coverage through the Federal Affordable Care Act marketplace, but she can no longer afford it. So today she relies heavily on community clinics and support programs to help keep her family afloat.
If I didn't have these programs like how they do out here, I would probably be struggling. Literally, like how most people are these days.
Her experience reflects a growing national problem. The enhanced federal health care subsidies created during the pandemic expired at the end of the year. Since then, insurance costs for many Americans have jumped. Here in Oakland and across the U.S., the Affordable Care Act is growing less affordable. According to new federal data obtained by the nonprofit group Notice, 21% of Obamacare recipients this year lost coverage after they failed to pay their first bill. That's 1 in 5. Enrollment nationally appears down by millions. A new survey from KFF, a major nonprofit organization focused on healthcare and public health issues, finds 80% of those who kept Obamacare say their costs have increased significantly. More than half say they're cutting back on food and household necessities to afford healthcare. Nearly 1 in 10 now say they can't afford it at all and are now uninsured. For families like Vanita's, it becomes a matter of priorities, paying for health care or paying for everything else.
I would struggle. It would definitely be a struggle. I would really have to come out of pocket.
Healthcare affordability is emerging as a political issue heading into the midterm elections, with many voters saying rising medical costs could influence their vote. But for many families, the concern is more immediate. Just getting by one day after the next without a healthcare emergency. Hendren, Jazeera, Oakland, California.